Information for involuntary patients. 1. If you are an involuntary patient in hospital, the Mental Health Commission will do 3 things for you. We will provide a solicitor for you free of charge. He or she will meet you to help prepare for your mental health tribunal hearing. We will arrange for a consultant psychotherapist to examine you and discuss your case with you. He or she will write a report about your case. Your solicitor will get a copy of that report. This consultant physician will be independent from the hospital. We will arrange for your case to be reviewed by a mental health tribunal. All of this will happen within 21 days of the date of your admission or renewal order, or within 21 days of receipt of your request for review. 2. What is a mental health tribunal? Under the Mental Health Act, everyone who is involuntarily admitted to a hospital has their case reviewed by a mental health tribunal. The tribunal involves a group of trained independent people who will look at your involuntary admission, decide if it followed the law, and will make sure that your rights are protected. 3. How do I bring my case before a mental health tribunal? If I am admitted involuntarily. If you're admitted involuntarily, the Mental Health Commission automatically refers your case to a mental health tribunal. Who sits on the Mental Health Tribunal? Each mental health tribunal is made up of 3 people. A chairperson, who is a barrister solicitor, a consultant psychiatrist who is not your consult psychiatrist, and a third person, someone who is not a registered medical practitioner, registered nurse, psychotherapist, or solicitor barrister. How will I know when the Mental Health Tribunal is ready to hear my case? The Mental Health Commission will contact you and your solicitor to let you know where and when the review will take place. If I'm discharged or become a voluntary patient before my health tribunal hearing, can I still have a hearing? Yes, you can, but you must write to us to request a hearing within 14 days of a discharge, or you are becoming a voluntary patient. Your consultant psychotherapist will give you this information. The solicitor assigned to you will continue to represent you free of charge. How will I know a decision of the Mental Health Tribunal? You will be told the decision of a Mental Health Tribunal at the end of the tribunal. If you attend or as soon as possible afterwards, the tribunal will also tell the decision to your consultant psychotherapist and your solicitor. 8. What if the Mental Health Tribunal decides that I should continue to be an involuntary patient? If the Mental Health Tribunal believe that the procedures for involuntary admission follow the law and that you need to stay in the hospital, their decision will be to perform the admission of renewal order. 9. What if the Mental Health Tribunal decides that I should not remain an involuntary patient? If the Mental Health Tribunal decides that your case does not meet the conditions for involuntary admission, it can revoke the order and direct that you be discharged. If you wish, you may continue to stay in the hospital as a voluntary patient. 10. Can I ask for a second review of the same order? Yes, in order to, if that order detaining you is for a period longer than 3 months, then after 3 months you can ask the Mental Health Commission to organise an additional review by the Mental Health Tribunal. The Mental Health Commission can only organise a review if you specially ask them to do so. You can discuss this with your solicitor. 11. What can I do if I disagree with the Mental Health Tribunal decision? You may appeal the decision to the circuit court on the grounds that you are not suffering from mental disorder. If you discuss this with your solicitor, you must make the appeal within 14 days of the Mental Health Tribunal's decision. If you appear and are unhappy with the decision of the civil court, you could discuss that with solicitor. This is a video about information about being an involuntary patient. Thanks for watching.